Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. When most people hear the word ultrasound, they immediately think of pregnancy. But ultrasound is used for much more than that. Healthcare professionals use ultrasound to examine organs, muscles, tendons, blood vessels, the heart, and many other parts of the body, all without using ionizing radiation. So how can something as simple as sound create detailed images inside the human body? Today, we'll explore the fascinating science behind ultrasound and discover how sound waves help healthcare professionals see inside the body in real time. To understand ultrasound, we first need to understand sound. Sound is a form of mechanical energy that travels as a wave through a material such as air, water, or human tissue. When something vibrates, it causes nearby particles to move back and forth. That movement creates a wave that carries energy from one place to another. The sounds we hear every day, like voices or music, have frequencies that the human ear can detect. Ultrasound uses the exact same type of wave, but at frequencies that are far higher than humans can hear. That's why it's called ultrasound, meaning sound beyond the range of human hearing. Medical ultrasound systems typically operate in the megahertz or MHz's range, which is millions of sound wave cycles every second. These high-frequency sound waves make it possible to create detailed images of structures inside the body. The handheld device used during an ultrasound examination is called a transducer, although many people simply call it the ultrasound probe. Inside the probe are special materials known as piezoelectric crystals. These crystals have an unusual property. When electricity is applied to them, they change shape very slightly and vibrate. Those tiny vibrations generate high-frequency sound waves that travel from the probe into the patient's body. Interestingly, the same crystals also work in reverse. When returning sound waves strike the crystals, they vibrate again and generate tiny electrical signals. This means the transducer acts as both a speaker that sends sound into the body and a microphone that listens for the returning echoes. This remarkable property of piezoelectric materials is what makes modern ultrasound imaging possible. One of the first things you'll notice during an ultrasound examination is the gel. Many people assume it's simply there to help the probe glide across the skin. While it does make scanning easier, its real purpose is much more important. Air is a very poor conductor of ultrasound waves. If there were a layer of air between the probe and your skin, most of the sound waves would reflect away before entering the body. The gel removes that thin layer of air and creates good contact between the probe and the skin. This allows the sound waves to travel efficiently into the body and return with clear information. Without the gel, ultrasound images would be much more difficult and in many cases impossible to obtain. Once the sound waves enter the body, they begin interacting with different tissues. Whenever a sound wave reaches a boundary between two tissues with different acoustic properties, part of the wave continues deeper into the body, while part of it reflects back toward the probe. These returning echoes contain valuable information. The ultrasound system measures how long each echo takes to return and how strong that echo is. Because the speed of sound in soft tissue is relatively constant, the system can estimate where each reflection originated. A computer processes millions of these returning echoes every second and converts them into the real-time images displayed on the monitor. Unlike many other imaging modalities, ultrasound allows healthcare professionals to watch structures move as they examine them. That means they can observe muscles contracting, heart valves opening and closing, blood flowing through vessels, or even a developing fetus moving during pregnancy. Ultrasound doesn't just create pictures of organs, it can also help evaluate how blood is moving through the body. This is called Doppler ultrasound. When sound waves reflect from moving red blood cells, the frequency of the returning sound changes slightly. This is known as the Doppler effect. The ultrasound system analyzes these frequency changes to estimate the direction and speed of blood flow. Color Doppler displays blood flow as colored overlays on the image, while spectral Doppler produces waveforms that help evaluate blood flow patterns. Doppler ultrasound is commonly used to assess arteries, veins, heart valves, and blood flow to organs. It can help detect narrowed arteries, blood clots, abnormal blood flow, and many other vascular conditions. Ultrasound is used in many different healthcare specialties. General sonographers examine organs throughout the abdomen and pelvis, including the liver, kidneys, gallbladder, pancreas, and reproductive organs. Obstetrical sonographers monitor fetal growth and development throughout pregnancy. Vascular sonographers evaluate arteries and veins throughout the body using Doppler ultrasound. Cardiac sonographers, often called echocardiographers, use ultrasound to examine the structure and function of the heart. Musculoskeletal sonographers assess muscles, tendons, ligaments, and joints. Ultrasound is also frequently used to guide procedures such as biopsies and fluid drainage because it provides real-time imaging during needle placement. Regardless of the specialty, sonographers combine advanced technical skills with patient communication, anatomy knowledge, and critical thinking. One of ultrasound's greatest advantages is that it does not use ionizing radiation. Instead, it uses sound waves, making it an important imaging option in many situations where radiation is not required. Although ultrasound has an excellent safety record when used appropriately, it still requires trained professionals who understand how to optimize image quality while following established professional guidelines. Like every imaging modality, ultrasound also has limitations. Sound waves do not travel well through air, which makes structures behind gas-filled bowel or the lungs more difficult to visualize. Bone also reflects most ultrasound waves, preventing ultrasound from seeing through the adult skull or inside most bones. This is why CT or MRI may sometimes be a better imaging choice, depending on the clinical question. Each imaging modality has strengths and limitations, and healthcare providers select the examination that is most appropriate for the patient's needs. Here's an interesting fact. Modern ultrasound machines have become so compact that some systems are now handheld and can fit into a healthcare professional's pocket. These portable devices are increasingly used in emergency departments, intensive care units, ambulances, and rural communities, allowing clinicians to perform focused bedside assessments within minutes. As technology continues to improve, ultrasound is becoming even more accessible in a wide variety of healthcare settings. Let's quickly review what we've learned. Ultrasound uses high-frequency sound waves rather than ionizing radiation. The transducer contains piezoelectric crystals that both produce sound waves and receive returning echoes. The ultrasound system measures those echoes and converts them into real-time images of structures inside the body. Doppler ultrasound can also evaluate the direction and speed of blood flow. Ultrasound is safe, versatile, portable, and used across many areas of healthcare, including obstetrics, vascular imaging, cardiac imaging, abdominal imaging, musculoskeletal imaging, and image-guided procedures. Ultrasound is an incredible example of how sound can be transformed into valuable medical information. By combining physics, technology, anatomy, and patient care, sonographers help healthcare teams diagnose disease, monitor pregnancy, evaluate blood flow, guide procedures, and improve patient outcomes every day. In our next episode of How Medical Imaging Works, we'll explore another fascinating technology by learning how MRI uses powerful magnets and radiofrequency energy to create detailed images of the human body, all without using ionizing radiation. Thanks for watching in the Know Medical Imaging. If you found this video helpful, be sure to like, subscribe, and share this video to spread more in the know about medical imaging. What surprised you most about ultrasound? Let us know in the comments, and we'll see you in the next video.